All right, so moving right along, I want to next get into, not sure if you can see this okay, it looks a little crooked to me. And I want to get into surgical management. So we're talking about PTCA, percutaneous transluminal coronary angioplasty, which most of us know and have heard angioplasty. Basically where they take a catheter, insert it into most likely the femoral artery, take it all the way up and get to the blockage in the coronary artery, much like they would do a cath, but this now we have a purpose to take what would be like a balloon and move into that vessel. And once it's in there, because obviously at that time it's deflated to get through the vessel, and then when it gets to the blockage, the balloon is blown up, and what that kind of does is take that plaque and push it up and kind of open up so it's not blocking as much, because some of that plaque, probably most on the surface, can be soft. And what they'll do is they'll just inflate that balloon and it kind of just pushes that plaque, that calcification, the fibrous tissue, the fibrous that has formed over there, and just push it to kind of widen that opening. And they'll do that. So that is what that is. We hear about that. Oftentimes, you can see stents are also on the screen there. Oftentimes they might do that and stents at the same time, or one or the other. Laser angio, I don't see that much. And so we probably won't focus on that a whole lot. I don't know exactly what they do, if they go in and with the balloon and actually laser it. Don't worry about knowing that for the test. I'm certainly not going to focus on it too much if it's not something we see a lot of. However, we do see a lot of stents. So that is where they take that same thing, introduce the catheter into the groin, where they go on in, find the blockage, and they place a stent, which is like a wire mesh. And I think some of you have probably seen videos or pictures or whatnot. If you haven't, please do so. Look in your book, get on YouTube, and look those up. And basically, it's same thing. Instead of inflating a balloon, or they might inflate the balloon and then place the stent, what they could do is just take the stent in there, inflate it, or open it up. It pushes the plaque back, and because it's a wire mesh, kind of embeds in there and kind of keeps it open. A lot of the times those stents are covered in an antiplatelet, anticoagulant type of medication, so it prevents any type of aggregation of platelets or formation of more plaque. So those do last for about 10 years or so. Their patients are on medications to keep those open, to keep them from clot formation or plaque formation from building. Usually an antiplatelet, sometimes Plavix, sometimes they're on Coumadin, those types of things, but about 10 years. And sometimes the symptoms come back and the patient has to go back in and have that area reopened up, either more stents placed, or whatnot. I don't know that, I don't believe that they've removed stents, but I'm not 100% sure on that. The DCA and rotoblators, DCA stands for directional coronary angioplasty. We're not focusing too much on that. However, what it is going in the same way you do for PTCA and for stents. They go in and it's got like a little blade on it, and it kind of like Roto-Rooter goes in and cleans out your drain, your pipes. So when it kind of kind of breaks up that plaque, kind of spins around in there, and then is sucked up or taken out with the catheter itself. So again, we won't focus too much on that, nor will we on the next two, on the transmyocardial laser revascularization. However, the next one is coronary artery bypass graft. We should all be very familiar with coronary artery bypass graft. That's the CABG. Oh, they had a CABG done in 2012. That's your open heart surgery. They have bypassed the blockages. So they've taken an artery from someplace else. Sometimes a mammary artery is common, sometimes arteries in your legs. They'll go ahead and go on in, and they will take a vessel that they'll harvest one from your own body, because we won't reject it, right? And then we'll go ahead and the physicians will bypass that. And that is what we mean by bypass or cabbage. That is what happened to Professor Cook's husband. This is where they bypassed 4 of those 5 blockages, and one of the bypasses, like I mentioned, plotted off. However, so he still has 3 functional bypasses. I hope that makes sense. If not, it's in your book. All right, nursing management. This is not new material. This is not something you don't know anything about. This is nursing management. This is what you do as a nurse. Okay, so obviously we talked a lot about it. Prevention education, diet and exercise, smoking cessation, medication teaching. You need to tell them what they're going to expect with statins, what signs and symptoms, what side effects. Education about the tests that they may be receiving. What, I'm getting a cath, what does that mean? Will I be under? Will I be awake? What does that mean? Surgical procedures. The doctor wants to do a cabbage. What does that mean? What will happen to me? What happens during the surgery? That's your job. Okay, so this shouldn't be a surprise to anybody. This is a question for you. I want you to think about that. A patient is prescribed niacin for hyperlipidemia, and the nurse provides instructions to the client about the medication. Which statement indicates an understanding of the instructions? It is not necessary to avoid the use of alcohol. The medication should be taken with meals to decrease flushing. Clay-colored stools are a common side effect and should not be a concern. Ibuprofen, Motrin, taken 30 minutes before niacin should decrease flushing. The answer, when you look up niacin, you will find that it is D. Flushing is a common side effect, and taking Motrin prior to its administration will help with this side effect. Clay-colored stools are a sign of a hepatic issue. And should be reported to their physicians immediately. However, that is not the answer for niacin. So we're looking at for nursing interventions, nursing knowledge when it comes to these medications. So this would be a typical question, okay? What you can do as a nurse. The home health nurse is visiting a patient with an elevated triglyceride level and serum cholesterol level of 398. The client is taking Lipitor. Which statement by the patient indicates a need for further teaching or education? Constipation and bloating might be a problem. I'll continue to watch my diet and reduce my fats. Walking a mile each day will help my whole process. I need to follow up with my doctor yearly. Okay, that one should be pretty self-explanatory on that one. It is D. I need to follow up with my doctor yearly. One of the things we need to know about taking cholesterol medications is that, especially statins, because it works in the liver. When you look back at that slide and we look at the statins, it prevents the liver from producing lipids. So you can assume that a side effect could be elevated liver enzymes. Because it's working on the liver, much like medications that work on the kidneys, we can cause liver side effects. So initially, when a patient receives a statin or a cholesterol-lowering medication, this one in particular is Lipitor, the doctor will want to make sure that they come back in, usually maybe a month, but typically 3 months. Okay, you're going to start this medication. I want you to make it a follow-up appointment in 3 months because I want to check your liver enzymes. I want to make sure that we're not hurting your liver with this type of medication. So when this patient, this one in this question, with elevated triglyceride levels and serum cholesterol, this patient assumes that she does not need to see her doctor for a year. Well, when they start this medication, she needs to be following up regularly. Initially 3 months, then this doctor may say, okay, I want to see you another 3 months, so a total of 6 months. Then they may say, okay, we can wait 6 months, I want to do another one. They're going to closely monitor your patient to make sure that these medications are not harming your liver. Once they have determined that that's not happening, then we can say, okay, I only need to go once a year. All right? So keeping in mind, we talked that constipation, bloating, GI disturbances are a complication. Okay, that's why I said a lot of them don't like, I said diarrhea, this says constipation. Well, GI disturbances, don't let that confuse you. It's not one or the other. It can be constipation, it can be it can be diarrhea. Okay, definitely bloating, but GI disturbances right there, that's all you should think about. Yes, I can watch my diet and reduce my fats. Yes, exercise is good. This is the best answer, okay? Because we want follow-up regularly when we are on a statin because it harms the liver. It can harm the liver. I hope that makes sense. All right, here's some videos I want you to watch. What I'm going to do, simply for the purposes of time, I'm going to take these videos. They're very good. One's just basic on coronary artery disease. The one is really cool. That is actually a heart attack or a blockage. It's an actual dissection of a gentleman that, I believe it's a man, that passed away, and they are actually slicing his heart, one of the coronary arteries, in slices that you can actually see where the heart attack happened. So it's very cool. Not cool for the person who died, but it really gives you a nice visual to actually see what happens when somebody dies from complete blockage, when somebody dies from a sudden heart attack. Okay, so it will be evident. I will send these in a separate email or D2L, somewhere like that. You will get this simply because it will help you, but I'm not going to do it on here because as many technical difficulties I've had, I'm not going to take any more. So you will get these, however, there's 2 of them. The next thing is stable angina. This is what we're going to talk about here. We'll just get it. This is fairly quick, and it gives you a little bit more information about what that means. So angina pectoris. This is basically an imbalance between the coronary's ability to supply oxygen and the cardiac muscle's demand for the oxygen. So what that means to you, we will talk about in just 1 minute. I want you to think about, because I'm going to have to pause here, I want you to think about why that happens and what angina is. Obviously, it basically means